So Cameron, what is trauma exactly? I think sometimes people have a misconception of what trauma means, and they think of maybe, someone who is a veteran of war, but it can mean a lot more than that. How would you define it specifically for children?
Right. So for children, it can be a wide range of things, but usually it's marked by some kind of significant event or reoccurring event that creates fear and a sense of their safety being threatened.
Okay, so a lot of times kids will know that they have symptoms, maybe that they're experiencing trauma if they're exhibiting symptoms of fear or feelings of threat.
Right.
Okay.
And that can range from witnessing domestic violence, having a painful medical procedure done, also getting in a car accident, loss, and losing someone that they really cared about.
Really?
And it can be a variety of things.
So would you say that children could even experience trauma after their parents get a divorce?
Yes, they can, because it's very anxiety provoking, and it's a sense of loss in that degree as well.
What would you say are some of the more common symptoms of post-traumatic stress?
So it varies from child to child. Some children will be very withdrawn and timid, and then there will be other children that will act out and be very aggressive and very reactive.
So it can show up differently depending on the child.
Exactly.
So are there differences when maybe a younger child is influenced by a traumatic event versus an older adolescent?
It depends on the child again. Typically, though, when I see younger children going through a traumatic event or have witnessed something very, very traumatic, that they withdraw and they might be especially clingy to their caretaker. Whereas older ones, you might see actually lashing out more and withdraw.
Interesting. Okay. Talk to me some about the flight or fight response in the body and how trauma is manifested there.
So children typically go into this freeze mode or fight mode.
Okay.
And their perception of reality is, I guess you would say, shattered. Everything seems to be frightening in the world. And so what therapy does for children who have endured trauma is kind of give them that sense of safety back and give them that sense of comfort that they had lost during the trauma.
Interesting. So I know you have a lot of experience working with children of all ages who have experienced different kinds of trauma. Are there any specific therapeutic strategies that you use, or do you like to get the parents involved, or is it generally more one-on-one? What's your approach?
My approach is client-centered.
Okay.
And I also really like to use what we call a holistic approach. So not only tuning into emotions and thoughts, but also tuning into somatic symptoms.
Why don't you explain somatic symptoms for our viewers?
Okay, so somatic symptoms is physical signs in the body that show up with the child. So that could range from increased heart rate to, kind of physical tension in their muscles.
Yeah.
And so I help the child identify, when does your tummy hurt? When is there warmth going through your body? And let's kind of explore that a little bit.
Yeah, I noticed that children a lot of times, they'll say they don't want to go to school because they have an upset stomach or they don't feel good, they have a headache. A lot of times when your child is saying something like that over and over again, would that be an indicator that maybe something more is going on?
Yes. In the past, working with children, I've talked to parents telling me that they've gone to the nurse numerous times and they're trying to figure out what it is.
Right.
And oftentimes it's anxiety that's coming up for them.
Awesome. Okay, well, thank you for explaining trauma and its manifestation in children and adolescents.